Welcome to the Art of Healing podcast, the podcast that is dedicated to helping you connect with your mind, body, and spirit. This is Charlize, physician and Reiki master, and thank you so much for joining me. I would like to remind you that although I'm a physician, the information you receive in this podcast is for educational and entertainment purposes only. You can find my full disclaimer at my website, www.healingartshealthandwellness.com. If you like what you hear on this podcast, sign up for my weekly newsletter. Check your show notes for more information and for the link to sign up. Thank you. For this podcast, I'd like to give a brief disclaimer. I will be discussing medically related information. I would like you to keep in mind that although I am a physician, I am not providing medical advice or functioning as your personal physician throughout this podcast or on my website. And for more information, you will need to consult your physician, nurse practitioner, physician assistant who is caring for you. All right, thanks so much. Hello, and welcome back to the Art of Healing podcast. This is Charlize. For today's episode, I actually wanted to circle around to a blog post I did a few weeks ago. And the reason why I did it is because I needed to research and brush up on some things for a Zoom talk I did with an organization that I've been participating in that's trying to get some information out there to the public, particularly to people of color. Um, so I had decided to cover how to ways you can reduce your chances of contracting coronavirus. Now, I will just state completely that as I've been creating my blog, my podcast, all of my content, um, I haven't necessarily ignored coronavirus. However, I think it is just one of many, many health crises in in at least the United States, probably worldwide. But and so and then it's such a rapidly changing topic. And because I'm a practicing physician, that I have to devote time every day to stay up to date on it. Um, so for the most part, when I'm providing content, when I'm on my site, I tend to not discuss it too much, other than I'll always say to follow your state and local health guidelines and to follow the advice that we know, which is to wear a mask, wash your hands, socially distance, and avoid large gatherings until we know that the pandemic is in control. Um, but one thing with this topic that's important to know, that's actually always been around even before the pandemic, is that having certain conditions, diseases, a certain status in your body can increase your risk of definitely contracting coronavirus. It can increase your risk of becoming extremely ill once you've contracted coronavirus or dying. But those same factors actually can affect your life across the board and could always have increased your risk of influenza or shingles or cancer. So that's going to be having a general state of inflammation in your body. When we use the term inflammation in medicine, um, basically we mean that the immune system is activated and there is some processes happening that the body's attempting to heal something, contain something, um, to do away with something, fighting something. Very generalized term that we use. But being in a state of inflammation has always been a risk factor for many things. It's a general term. And in day to day practice, often most physicians are probably going to avoid the topic because it's so broad and so all encompassing. What does it mean? What do you do once you find out this information? So I figured I'll use this podcast to circle around. I will place a link to the post that will go with some of this information, because I'm talking, guess you're listening. Um, there will be some numbers, and if you're kind of a visual person, I'll make sure that you can see some of these things and numbers I'm discussing. So, for the talk that I did in particular, we were discussing coronavirus, how it's going to affect the general public, and we were speaking to a very specific audience in the state of Oklahoma. However, there are a number of studies, and probably most of us are aware that if you have certain chronic illnesses, your risk are increased. And or if once you contract the disease, your risk of becoming really sick, so maybe needing oxygen support, maybe needing a high level of medical care, such as ICU or critical care, goes up. These same factors can also predispose you from taking a longer time to recover from the infection. So I had found an article called The Inflammation Link and the Role of Nutrition and Potential Mitigation. This is on PubMed, and I will make sure to put that in the link as well. And it was a very interesting way it was stated that your risk of contracting coronaviruses could be based on your non communicable diseases. So, some of these we know, which will be diabetes, chronic obstructive pulmonary disease, heart disease, including high blood pressure, congestive heart failure, but really any cardiovascular disease. So, maybe like abnormal heart rhythm, um, being a smoker, or having cancer. So those were some that the current research states, and please recall this is rapidly changing. Even as I'm creating this podcast, this list may even change beyond that. But what I've noticed in my general practice over the years is that um, patients that I meet that describe an overall state of unwellness, typically, and often they don't have any one thing. They just don't feel well. Joints ache, fatigue, um, memory troubles, swelling in the legs and feet, um, aches and pains. It's just overall unwellness, but there's not any particular like one thing that stands out. When we start to do their workup, we discover that they're in a state of inflammation. In in medical practice, if we want to check someone's inflammation level, and keep in mind this is very, very general, and some of these tests that I'm going to be discussing, many times they'll be done because we know of the existence of a disease and we're trying to monitor and treat that disease, or we have a high suspicion of a certain disease and this lab is going to help. These two labs are going to help. But two general inflammatory markers that often I will check in individuals that maybe just, we don't know exactly what we're after, but they don't feel well. So we need to find out what it is. One's called an ESR, an erythrocyte sedimentation rate, and one's called a CRP, a C-reactive protein. So these two markers are labs that, if you're working with a doctor, you may have had them checked. They're easily checked through blood draws. Sometimes they're part of other labs, and depending, like if you're seeing a functional medicine practitioner, they may be part of a protocol that they're already doing. But the key with knowing these numbers is if they're elevated, it implies that the immune system's activated, it's working, there's a fight going on. internally. But unfortunately, these labs aren't going to tell us where it is and exactly what it is. So we can see the ESR and CRP be elevated in a minor injury, like a bruise or a sprained ankle or a cut. We can also see the ESR and CRP be elevated in a serious illness, like cancer that's spread or metastatic cancer, or a severe blood clot in the lungs, a pulmonary embolism. So it helps to know these numbers. And often I will check these in my own patients and I'll tell them that, the slabs, these are general, kind of just a general marker. It isn't going to give us a diagnosis, but it can be a really powerful tool after having a thorough workup and getting a good history, a good physical exam to point us in one direction or another. And really important that if maybe nothing in particular is found, no autoimmune disease is found, nothing like rheumatoid arthritis is discovered, um, that how you proceed as far as getting that person to feeling better, you can use those markers to see as they're going down and how they're feeling. Interesting note is that someone who is in sort of a metabolic crisis, and the way that I often interpret that is someone who may be experiencing weight gain, a rise in their blood sugars. They may be headed towards diabetes, but they're not diabetic yet. It's not unusual to see those inflammatory markers go up. Now, granted, and keep in mind that needs to be part of a thorough workup, that needs to go with lots of history and some other workup. But definitely, it's not unusual to see that those inflammatory markers start to rise as a precursor to something else that's coming. So I think those are nice to know because they're a target that we know we should try to get that down. And if we don't find any serious medical illness that requires immediate intervention, that is, we're working with nutrition and lifestyle, that we should see a response in those. Um, we're all used to getting our cholesterol or like lipids checked, probably part of a yearly um, workup, a yearly exam. And of course, if you're being treated for high cholesterol, you get those checked on a regular basis. Um, I often like to see the cholesterol levels as a marker of inflammation. And there's particular numbers that I often will use when I'm discussing with our patients that I'll let them know, hey, this is letting us know that your body's having a tough time, not with one thing, but many things. So, here's some improvements that we'll want to make based on that. And in the cholesterol, one of those is going to be the HDL, which is called the high density lipoprotein. So that's the large the large cholesterol particles that flow through the bloodstream. So I think most people by now are familiar with this, but we have different panels we look at in the lipid panel and cholesterol, and we do want some of them to be low, but the HDL we actually like to be high. We like that to be higher than what the lab recommends generally because that cholesterol helps to clean out debris and it helps to clean out some of the bad cholesterol and help with repair, or help to clean out the arteries and helps to prevent heart attack and stroke. And then there are a bunch of studies that show that elevated HDL levels in general is a good marker of good health and a lower chance of having something like a heart attack or stroke. So if we're seeing that the HDL is low, I'll often point that out to patients and let them know, like, hey, we should see this go up. And it's one I actually like to discuss because, for the most part, I don't really have a medicine I can prescribe that's going to raise your HDL. So that's one that we'll see go up if someone improves their lifestyle, if they're getting good, healthier movements in, getting their blood flowing, if they start to improve their nutrition and they're starting to get more fresh fruits and veggies into their diet, if we're getting a lot less processed foods that might be raising their blood sugars. That's actually kind of our only way to really get that HDL up. So, oddly enough, it's one that I like to bring up to patients because while there's some things I can prescribe to help, and then, of course, depending on your medical history, we may have to prescribe to prevent disease. That's one that I know I can't necessarily um, use a pill to fix. That one will be under the patient's control. So, knowing your HDL, knowing that number is an awesome idea, knowing what the lab values are and then where yours stands. Um, Another inflammatory marker that I like to know is going to be the triglycerides, which are part of that lipid panel. And we can lower triglycerides with medication, but again, it's one that I like to point out to patients because if they're heading into a sort of a metabolic crisis, they're not diabetic, but maybe on their way, the triglycerides will tend to be high as a response to the blood sugars being high. So it's one that we like to watch to make sure we get that down with lifestyle. There are a few other pieces of information that I personally like to know, and they're not necessarily inflammatory markers, maybe just my own nitpickiness, but it is important to know the status of your kidney function, and there are two labs that relate to that called a BUN and a CR. It may be you may see it listed that way, or a BUN and a creatinine, and those are numbers related to your kidney function. Um, this one in particular for minorities is actually very important because I've noticed over the years that for busy physicians, our tendency to follow just the lab values on what's acceptable, we tend to overlook if there's a gentle rise. And because minorities are at such a high risk of kidney disease, I think it's very important to note any trends, any upward trends over the years, to notice if those labs are starting to get just a little bit above normal. When I see that in my own patients, I'll point it out to them and let them know, like, we're starting to see a rise and see if that correlates with other things like blood sugars going up, liver tests going up. Now, not necessarily that this is kidney failure, but in a way, it's sort of an inflammatory marker that lets us know that this organ is starting to feel the strain of um, too much of something we don't need going into the body, not enough of something we need coming into the body. And we're starting to see the very beginning. So, unfortunately, in modern healthcare in the United States, the tendency is not to manage things until it's a crisis, but we really want to be aware if that BUN is starting to rise year after year, if that creatinine is starting to rise, especially if you're a person of color. It's very particular. Um, and then, of course, I think most folks are pretty familiar with this, and I think almost everyone I come across, patients, friends, family, is aware of the role of vitamin D, the fact that most of us tend to be vitamin D deficient and that being deficient in vitamin D seems to impact our immune system and increases our chances of catching things like coronavirus or other infections. And we've always known for quite some time, the vitamin D deficiency affects our bone health, our mood, our skin, just affects all kinds of things. Um, so if you haven't had one checked, it's probably a good idea to get that vitamin D checked, which is just a simple lab. So I just wanted to touch on a few of those things for this podcast, and I will place a link to the blog post that I did for this. Um, and as I am, creating more topics, I want to delve into this deeper. And I do hope you understand that this particular issue, although it is important for COVID, these are issues I've felt are important for years for all patients. And that even once we're through this crisis with COVID, I think awareness of where you stand as far as your inflammation status is always important. So thank you so much. I was a little off my topic because normally we're discussing mindfulness and Reiki, but I think it's good to discuss some of this hard science stuff, some of this medical stuff, especially in this kind of setting where it's not stressed and we're not rushed. So thank you so much for listening. There will be more podcast episodes to come. Getting my courses ready. It's so nice to connect with you. Thank you for your time. Bye bye. Thank you so much for joining me for this episode of the Art of Healing podcast. Once again, this is Charlize. You can find out more about me at www.healingartshealthandwellness.com. Did you know I have a blog as well as online courses? Check your show notes to sign up for more information about healing arts, health, and wellness. Thank you. Please feel free to share this episode with your friends, family, and loved ones.